De qual céu mais você vem?
Hello again, ladies and gentlemen. Now I would like to speak about the CATALYS femtosecond laser in cataract surgery. CATALYS is a purpose-built femtosecond laser platform for cataract surgery only. It performs image-guided capsulotomy, lens fragmentation or softening, and can create primary side pot and arcuate corneal incisions. It is using optic liquid interface that is a non-applanating docking together with a 3D OCT guided planning and treatment. There are step-by-step procedures that patient undertakes. First one is the docking with a liquid optic interface that is a very stable and creates a gentle coupling. Afterwards, a full volume OCT is performing image-based planning, where you can plan full capsulotomy, its size and centration, and also lens fragmentation, and upon your choice, also arcuate incisions. Then the laser would create incisions and soften the nucleus. Afterwards, the patient is moved to next step. In this short video, I would like to show you how the laser actually works. It's very easy and very intuitive. After putting in the patient's data, you can choose what step of the treatment would you like to perform: capsulorhexis, lens fragmentation, arcuate incisions, or primary side ports. To be honest, we are not performing the primary side ports anymore. We still use knives or diamond knives for this. Afterwards, our surgeon has his own or her settings that are based on experiences and needs. I do use 4 different patterns for 4 different cataract densities. This one you're looking at, it's a very hard nucleus with a different spots spacing and different energy in front of the lens and different energy at the back of the lens. This second one is the so-called soft one. You can see that the shape is very different from what it was just a while ago. It's only a star shape, again with different spacing of the spots. In this video, you are going to see how we plan the surgery. After entering basic data like the first name and last name and the date of birth, you need to choose who is going to be the surgeon of the patient. After choosing a side of the eye, you go for capsulorhexis, and you can plan the size of the capsulorhexis as you wish. Afterwards, as seen a while ago, you can choose from different patterns, either hard one, or mid one, or a soft lens with a star shape. When this is set, you have a small summary that is telling you what is the laser going to perform after successful docking. Thanks to the liquid optic interface, you obtain very gentle docking and it minimizes also the intraocular pressure spikes. The integrated 3D OCT is delivering surface mapping for incisions, their depth and placement, and allows you to customize the location of the capsulorhexis. The fragmentation or the softening of the lens can also be very easy customized. And now let's speak about the help that the CATALYS brings to the surgeons. It's very precise and you can easily achieve highly repeatable procedures. Now, what we need to obtain the most is the circular and centered capsulotomies. That is actually granted with the CATALYS. Thanks to the lens fragmentation or nucleus softening, the effective phacoemulsification time decreases, and in tough eyes or eyes with altered anatomy, it is very helpful also. Here on the picture you can see how does the anatomy of an eye look. It's a very shallow anterior chamber. Here with the automated capsulorhexis, you don't need to move with your forceps in the anterior chamber and be a threat to the endothelium. And also, when the lens is fragmented, it's easier to aspirate than to phacoemulsificate. The surgery can go on. This is the planning of the surgery, where you can see the pattern of the eye of the lens fragmentation, and you can see the size of the capsulorhexis as I'm right now indicating. Afterwards, and the zone of lens fragmentation is indicated, and we can proceed with the surgery itself. The capsulorhexis takes less than 1 second and it's very fast. Afterwards, the lens fragmentation goes on in a duration of 12 to 15 seconds. Well, here what you see is the so-called stone rose pattern that is actually almost always present with a grade 3 or higher cataracts. After the treatment is done, we can proceed to a next step. You have seen several patterns. They are different and we use them as the nucleus or the cataracts are different. For soft ones we use different pattern, for denser ones we use different one. The denser the nucleus is, the denser the grid is, because I want the fragmentations or the fragments to be as small as possible and to ease the phacoemulsification of the particles. When we compare the standard phacoemulsification together with the flex performed with the CATALYS laser system, we need to speak about several studies that already had been performed. These studies show decrease in effective phacoemulsification time with flex comparing to the standard phacoemulsification. Also, in our facilities, we have done several tests and compared the effective phacoemulsification time of 100 eyes versus 100 eyes in an age group of 63 to 68 years of age. All of these cataracts were grade 2 to 3. All of these surgeries were uncomplicated. And here are the results. In our hands, we have seen a 70% decrease in the effective phacoemulsification time, and even 36% of all cases had zero EPT. That means a huge decrease in the effective phacoemulsification time. Not only the effective phacoemulsification time is for us important, it's also the influence of the whole treatment on the endothelium. In our group, we have seen mean endothelial cell loss in a range of 4.1% with flex and 0.3% with conventional phaco. So that means there is a difference between these two procedures. Overall, we can say that we have performed more than 20,000 cases with a CATALYS femtosecond laser. We lost suction probably 64 times, but have never seen incomplete capsulorhexis. We have never experienced corneal or iris damage, and we have never seen a posterior capsule penetration during the treatment. We have experienced several changes in the patient flow. First of all, I have to admit that my staff was not happy that we have a new device, and they were afraid of time gaps between the laser treatment and the phacoemulsification. It took us approximately 2 weeks to settle a process and optimize the process. I need to admit that using the femtosecond laser would either need one adjacent laser room or a big OR where you can fit the laser. Still, I can say that learning curve initially slows the process, but once the team standardizes the roles, the turnover can normalize or even get higher. And this is how it works in our facility. Patients are invited to the lobby and pre-op room. Here they are administered with all the pre-op drops and pre-op medications. Afterwards, patient number 1 is introduced to the laser suite, where his laser treatment is performed. Then the patient is transferred to an OR, and meanwhile the patient is transferred to an OR, me as a surgeon, I am doing a next laser treatment to a patient number 2. This patient number 2 is then waiting in the pre-op room or a pre-op hall, and then at patient number 3 is invited into the laser suite. So I have patient number 1 in the OR, then patient number 2 waiting in the hall, and patient number 3 in a laser room. Once I finish the surgery with patient number 1 in OR, I only go to the laser suite or laser room where I do perform next CATALYS treatment. And meanwhile, the patient number 2 is being placed into the OR, and patient number 3 into the pre-op hall. Patient number 4 is transferred from the pre-op room to the laser suite room. This is very fast, and we actually create a roundabout of patient, which is saving our time. Let's have a look at the whole problem from the patient side. The patient is gentler to the patient. We use less ultrasound energy, we see less endothelial stress, we see early corneal clarity, and this means better visual acuity for the patient. The laser brings consistency. It is very important, as I've already mentioned, for the premium IOLs, where the centered capsulotomy supports effective lens position and is helping us to obtain better visual results after the surgery. Plus, it's very comfortable, and I have to admit, patients somehow do trust lasers and robots more than they do trust us doctors. So if they have a possibility to choose the treatment that would be a standard cataract surgery or a femtosecond laser assisted cataract surgery, they would rather choose the femtosecond laser assisted surgery. Let me conclude that the CATALYS brings image-guided precision and energy reduction to cataract surgery. Both the surgeon and the patient do benefit from the procedure, as the phaco energy is reduced, and we also have seen more protection for the corneal endothelium. This is all from my side about the CATALYS assisted cataract surgery, and I do thank you very much for your kind attention. Enjoy your stay in Barcelona, and bye-bye.